Can I ask you something really personal? When is the last time you sat down with your parents' bank statement or your own and actually asked the question, can we afford this? Not the it'll probably work out version of that question, not the we'll figure it out when we get there version. The real, honest, terrifying version. Do we have a plan? Because if care is needed in the next 6 months or in the next 6 weeks, do you actually know how to pay for it without losing the house, draining your retirement, or destroying family relationships over who owes what to whom? If that's the question that made your stomach drop, this episode is for you. Welcome back to From Overwhelmed to Relieved, the Senior Caregiving Podcast. I'm your host, Shannon Calles, Senior Care Consultant, Advocate, Certified Dementia Practitioner, and someone who has walked this caregiving path both personally and professionally. This is the podcast where we break down senior care decisions, talk honestly about dementia and caregiving, and help adult daughters find relief while taking clear, loving action. Because you deserve to get your mom the care she deserves without losing yourself in the process. If you're juggling your own life, work, marriage, kids, while trying to care for a parent with a complex need, if you're exhausted, overwhelmed, and secretly wondering how much longer you can keep doing this, you're in the right place. Today is where we speak truth with tenderness, accept the messy realities of caregiving, and remind you that choosing yourself and loving your parent isn't selfish. It's necessary. If you're staring down the reality of needing senior care for a parent and have absolutely no idea how you're going to pay for it, or worse, if you've been told Medicare covers that and you started to wonder if that's actually true, this is the episode you didn't know you needed. Today, we are going to talk about the money. I know, nobody loves that conversation. But here's the thing, not having it costs far more than having it. And families who wait until there's a crisis to figure out the finances, they are the ones who end up with the fewest options and the most regret. So let's go. No jargon, no judgment, just truth with tenderness. Let me start by saying this out loud. The financial piece of senior care is the part that keeps families up at night. Not just because care is expensive, though it absolutely is, but because families have absolutely no roadmap for it. According to Genworth's Cost of Care Survey, the median monthly cost of assisted living in the United States is around $4,500 to $5,000 a month. Memory care can run $5,000 to $7,000 a month or more here in the state of Washington. And adult family homes here in Washington state, those similar home-like settings typically range from $8,000 to $11,000 a month. That is not a typo. And for most families, that number lands like a punch in the gut to them. And when I sit with families in my consulting work, I see the same moment over and over again. The moment they finally look at the numbers, the silence, the deep breaths, sometimes tears, and then the question I hear constantly, Shannon, does Medicaid care pay for any of this? And that's where I have to tell them the truth. Because the biggest financial mistake families make in senior care, the one that derails everything, is the Medicare myth. Here it is, plain and simple. Medicare does not cover long-term care. I'll say it again because I need you to hear it. Medicare does not cover long-term care. Medicare is a health insurance. It covers doctor visits, hospitalizations, short-term skilled nursing rehab, and after a qualifying hospital stay, it will cover hospice, home health when it's medically necessary. But the moment your parent is stable and simply needs help with activities of daily living, like bathing, dressing, meals, medication management, Medicare steps back. And that's exactly when the cost of care begins. This is not anyone's fault, and nobody teaches this. And the healthcare system, it is not designed to walk you through it. So families make plans around the benefit that doesn't do what they think it does. And they get blindsided at the worst possible moment, usually right after a hospitalization or a dementia diagnosis. I had a client, I'll call her Renee, who came to me after her mother had been in assisted living community for about 8 months. Renee's mom had moved in under the assumption that Medicare would pick up the cost after 30 days. It did not. Renee had been quietly draining her own savings to fill that gap, not telling her siblings, not telling her mother, just carrying it. By the time she found me, she was in a financial crisis and she was exhausted and she was drowning in guilt about all of it. Renee's situation was not unique. I see it constantly. And what breaks my heart is that with a little advanced knowledge, she would have had so many more options. So today, I want to give you those options because there are good ones. You just need to know where to look. When it comes to paying for senior care, there really are only four primary funding sources. Most families use some combination of them. And understanding what each one does and doesn't do is the foundation of your financial plan. So let's talk about that. One, private pay. Private pay simply means you're using your parents' own financial resources, savings, retirement accounts, investment, home equity, or a combination of all those. This is where most families start. And for many, this is where they stay for as long as those resources last. Here's what I want you to know about private pay. Your parents' money exists to care for your parent. And that's not selfish. That's not wrong. That's exactly what those resources are for. I have met so many daughters who feel guilty about using mom's money for mom's care because they were raised to believe that money was an inheritance, that it belonged to the next generation. I need to gently push back on that. Your parent worked for that money. It always was meant to support their well-being. Using it for a dignified care is honoring that. Two, long-term care insurance. If your parent was forward-thinking enough to purchase long-term care insurance, that is a tremendous asset. These policies vary significantly in what they cover. Daily benefit amounts, elimination periods, maximum benefit limits. So the first step is to pull out the actual policy and read it. Most people have no idea what their policy says until they're in crisis. Do not wait for that crisis. Pull it out now. Find out what's in it. And if you're not sure how to read it, ask your insurance agent or financial advisor who works with elderly care to walk you through it. Three, VA aid and attendance benefit. This one is criminally underutilized, and it frustrates me every time I see it. If your parent or their spouse is a veteran, they might be eligible for VA aid and attendance benefit. This is a pension-based benefit not tied to any service-related injury that can help cover the cost of assisted living, memory care, and family homes and in-home care. The benefit amounts vary on your status. So a surviving spouse might get over $1,000 per month. A married veteran might receive over $2,000 a month. A single veteran may receive around $1,700 or more. This number changes. So check with your VA benefit table for the most accurate figures. I have worked with so many people that are in a community that does not offer a Medicaid option after they have spent all their money, and then come to find out they actually qualified for VA aid and attendance and could have helped them live longer where they're at instead of waiting for the financial crisis. And now we have to find somewhere that will accept Medicaid on the fly. Please, if there's any military service in your parents' background, make one phone call this week. That benefit could change everything. And here we go. 4, Medicaid. Medicaid is the program that most families eventually need to understand and the one are the most confused about. Here's plain language version. Medicaid is a joint federal and state program designed to help low-income individuals pay for long-term care. Unlike Medicare, which is a health care coverage, Medicaid does cover nursing homes in Washington state. It can also cover adult family homes and, in some circumstances, assisted living if the facility accepts Medicaid residents. That is the key question to ask when you're going to any assisted living anywhere. Do you accept Medicaid when my parents run out of money? Because if your parents don't have, the Taj Mahal to sell and can pay for their care all the way to end of life, then they probably are going to need Medicaid at some point, and you're going to want to ask that question. But there are important things to know. First, Medicaid has income and assets limits. Your parent can generally not have a significant asset to qualify for Medicaid at the same time. This is where the concept of spend down comes in. You hear me talking about it a lot. If you move into a community that is just taking your money and you know that eventually you're going to need Medicaid, then you're sitting and spending down in the wrong spot. The process of spending down assets to the allowable limit before qualifying, that's what it means. Second, and this is critical, Medicaid has a 5-year look back. This means that if assets were transferred out of your parents' name within the last 5 years of applying, Medicaid will look at those transfers, may impose a penalty also, if during which time those benefits won't be paid. You're going to have a penalty from the time that you spent the money in the 5-year look back. So please do not try this without consulting an elder law attorney first. Third, Medicaid rules vary from state to state significantly. I need you to know that. What's true in Oregon is not necessarily true in Washington, and vice versa. Always work with someone who knows your state, specifically the Medicaid landscape of your state. The area of aging and disability in Southwest Washington is an incredible free resource for Medicaid navigation here in Clark County and here in Vancouver. There are also a small number of assisted livings that accept direct Medicaid placement. That means no spend down requirement. This is a conversation I have with families regularly in my consulting work. They had no understanding that the community that they were in, they were just giving them money. And when their money was gone, they would have to move somewhere that had a Medicaid contract with the state of Washington. It's a really sad but true conversation that I'm having with you right now. If you live in Washington state and you're still working, I want to mention one more piece, the Washington Cares Fund. Now, I know everybody was mad as hornets when they found out that payroll was going to take out some money for you to have this care benefit program. This is a Washington state long-term care benefit program funded by a small payroll contribution, like 0.58% during your working years, beginning in this July coming up in 2026. Eligible individuals who need help with 3 or more daily activities, those activities like dressing, bathing, eating, medication management, can access up to $30,000 toward a home care facility, equipment, or more in home care. This isn't going to fund a full year of memory care, but it is giving you something, and it's yours because you pay into it. For more information on that, you can visit washingtoncaresfund.wa.gov or call me. I've got all the info on that. I can give you all the tea. Let me tell you about a family that I worked with. I'll call them the Hendersons. When I met Linda Henderson, her dad had just been diagnosed with a moderate stage Alzheimer's, and her mom was 78 and exhausted from 3 years of caregiving alone. They owned their home, had some retirement savings, and her dad had served in the Navy in the 1960s. Linda was terrified. She had done some online research and seen the numbers and was convinced they were going to lose everything. She came to me saying, Shannon, I think we're going to have to sell the house just to keep Dad somewhere safe. Here's what we found out when we sat down and mapped it out together. Her father was eligible for the VA aid and attendance benefit that helped offset the cost of memory care significantly. Her mother, because the VA protects the community spouse, was able to stay in her home without spending down all her assets. And because we got ahead of the Medicaid look back, issue, right, that we talked about earlier, by working with an elder law attorney, the family was able to preserve the meaningful portion of their savings while still creating a sustainable plan for dad's care. I'm telling you, you have to start now. Linda told me afterwards, I was so sure we were going to lose everything. I had no idea there was this much help available if you just know where to look. That's what I do. I help families find what's available before the crisis. So you're making decisions from a place of knowledge, not fear. Here is your financial clarity roadmap. You don't have to do all of this today, but start somewhere. Pull together a financial picture. Gather information on savings, retirement accounts, Social Security income, any pensions, home equity. You cannot plan for something you cannot see. Check for a long-term care insurance policy. Look through your parents' paperwork. If you find one, read it or ask somebody to help you understand it. Verify military service. If there is any veteran status in your family, call the Clark County Veterans Assistance Center. One call could change everything. Call the Area of Aging and Disability. This is a free, no pressure resource. They can help you understand what Medicaid program exists in Washington and whether your parent might qualify. Consult with an elder law attorney before making any asset transfers. Not after, before. This protects your family in ways you cannot do alone. Call me. This is what I do. I'm not a financial planner or an attorney, but I help families understand the full picture, connect with the right resources, and navigate the placement process without overwhelm. I work with families, not facilities, not franchises, but families. This week's challenge has 3 steps. They're small, they are doable, and they change the entire trajectory of your family's care plan. Step 1, find the paperwork. This week, spend 30 minutes gathering what you know about your parents' finances. You don't need to have it all figured out. You just need to know what exists, what accounts, what insurance policy, and any military service. Step 2, make one phone call. Choose one of those, the VA, the Area of Agency on Aging. Let me say that again. It's so hard. It's like a tongue twister. Area Agency on Aging. Or book a call with me. I have my link in the show notes. It's a 30-minute call. One call. That's it. It doesn't cost you anything. It's free for you. Step 3, share publicly, post it on Instagram, and tell us, I am taking one step this week to figure out the financial side of my mom's care. You're giving yourself permission to look at this and saying it out loud. Maybe the exact thing another daughter needs to hear that she needs to do too, the same. This week's mantra, I don't have to have it all figured out. I just need to take the next right step. Write that on a sticky note, put it on the mirror, repeat it when the numbers feel overwhelming because you don't need the perfect plan today. You just need one honest step. If this episode felt like it was speaking directly to you, it was. You don't have to figure this out alone. And here's the truth. You're not supposed to. Caregiving is not a solo journey, and trying to handle everything yourself is exactly what leads to burnout, resentment, and regret. So let me help you. If you're in a crisis, hospital discharge, decline, dementia, confusion, book an urgent consultation with me, Shannon at clarkcountysr.com, or you can just text me, 564-227-8847. If you need help with clarity, if you need someone to help you make a plan or take action without pressure or guilt, reach out. That's what I'm here for. I work for families, not corporations, and my loyalty is to you, not facilities, not franchise, not quotas, not anyone else's agenda. And please, your review helps other daughters who are drowning in overwhelm find the relief they desperately need. You sharing your experience could be the lifeline for another daughter who needs to keep going. Next week, we're tackling another tough caregiving reality that no one talks enough about. You won't want to miss it. Thank you for being here. And until then, be gentle with yourself.